We believe that survivorship truly starts at a patient's diagnosis. Because of that, there are specific programs that are for patients that are on active therapy, such as our STAR-certified Oncology Rehabilitation Program. On the other hand, our Medical Oncology Survivorship Clinic is specifically for patients that have already completed therapy, roughly about a year to 2 years after.
The Medical Survivorship Clinic at St. Francis is offered to patients who are 1 to 2 years off of therapy, whether it be radiation or chemotherapy, and it kind of depends on what disease they have encountered on the time frame. But we meet once a month. The clinic's offered once a month, and we meet with the patients for a 1 to 2 hour visit, and we kind of go over their treatment history, whether they've received chemotherapy or radiation, and we meet with the nutritionist, the medical doctor, a nurse navigator, psychologist, and physical therapy is there as well.
The clinic focuses on celebrating the patients on the other side of their cancer journey, establishing or completing their care plan, and looking at what current side effects they may be experiencing and monitoring for long-term effects. The clinic does not replace the primary oncologist visits, but is adjunctive to those visits, more specifically looking at long-term and late effects.
The Medical Survivorship Clinic does bridge the gap just with the primary care physicians, especially because there's a lot of follow-up that needs to happen after chemotherapy or radiation, whether it be an annual chest x-ray or an annual echocardiogram or labs. And with the medical part of this clinic, we give those primary care physicians what kind of treatment needs to happen, and that way the patient doesn't necessarily have to follow up with oncologists as often, and a primary care physician feels enabled to act upon those things.
The survivorship team will compile a care plan for the patient and also for the primary oncologist and the primary care provider. This care plan serves as an outline and a summary of the patient's cancer experience, all the way from the specifics of their diagnosis to the therapy that lies after, from surgery, chemotherapy, radiation, transplant, and other therapies that may have been used. So the care plan at the end of the visit will be given, like I said, to the primary care provider, who will have this concrete and concise record of the patient's journey to be able to most effectively guide the long-term follow-up.
I believe it's important that we offer the Survivorship Clinic because patients are, I guess, bombarded with love and attention at their diagnosis and their treatment. But then when treatment stops, a lot of patients feel that they've just been let go and they have no one to turn to and to look to. But at that point, they need to know that there is the Survivorship Clinic to come to that will be there to support them through their journey to the end, remission and on beyond that, because they do have life to live after cancer and their treatment.
St. Francis and our oncology program are committed to the patients of this community and really value the fact that patients need to be followed for survivorship care, and we are very happy to be able to provide that service for the past year and a half.